Major updates have been released regarding Social Security, government funding, and critical assistance programs that affect millions of Americans. The latest announcement confirms that Social Security recipients will see a 2.8% cost of living adjustment beginning in January 2026. This increase translates to an average of about $56 more per month for retirees, amounting to roughly $672 per year. The adjustment, known as COLA, is slightly higher than projected due to inflation trends, but it also signals that prices for everyday necessities continue to rise. Around 75 million Americans who receive benefits through Social Security, SSI, SSDI, and VA programs will see their payments rise accordingly. The Social Security Administration had to delay its official announcement because the government shutdown interrupted the release of the Consumer Price Index inflation report, which is used to calculate COLA. Typically, the adjustment is based on the third quarter's CPI for urban wage earners and clerical workers covering July, August, and September. Despite the delay, the new rate has now been confirmed, bringing some relief to beneficiaries who have been waiting to see how their payments will change next year. However, as experts point out, an increase in benefits doesn't always mean people will feel wealthier. The same inflation that boosts COLA also eats into the buying power of those payments, leaving many seniors in roughly the same financial position. The adjustment also affects Medicare. Each fall, the open enrollment period runs from October 15 to December 7, giving beneficiaries the chance to review and update their plans for the next year. With Medicare premiums and coverage options changing frequently, reviewing plans during this window is essential. A higher COLA often results in slightly higher Medicare Part B premiums, which are deducted directly from Social Security payments. Beneficiaries are urged to compare their options carefully to ensure they're on the plan that best fits their health and financial needs for 2026. Inflation remains one of the driving forces behind these benefit changes. Recent tariffs imposed on international trade have increased prices on a wide range of goods, contributing to higher inflation rates. Some analysts have referred to this as the tariff bump, since it has indirectly caused a larger COLA increase. However, others caution that this kind of raise is bittersweet. While checks go up slightly, the cost of living often climbs even faster. The idea of using revenue from tariffs to strengthen Social Security funding has also been floated, and discussions continue about how these funds might be used in the future. Amid all these developments, the federal government shutdown continues to cause significant strain across multiple sectors. Reports indicate that over 500,000 federal employees have already missed paychecks, forcing many to turn to local food banks for help. A private donation of $130 million was recently made to temporarily support military pay, equating to roughly $100 per service member. Still, questions remain about how long such measures can sustain the situation if the shutdown continues. One of the most pressing concerns involves the Supplemental Nutrition Assistance Program, or SNAP. Nearly 42 million Americans rely on this program to afford groceries each month. With the ongoing government shutdown, the Department of Agriculture has warned that funds for SNAP could run out by November 1.